We do many neurologic tests to identify what area is the problem and how it's affecting the rest of the body. Now, some of the sensory tests we can do a pinwheel test where we run a pinwheel over the body that stimulates the small diameter afferents, which causes pain. So we can kind of check pain from one side of the body to the other, okay, to see if they feel right or they feel off. 2-point discrimination, that's where we're stimulating our Merkel's and Meissner's receptors. So we just do light touch on 2 different areas of the body to figure out if somebody's having trouble with poor sensation. Now we do a digit span test. This test is pretty neat. I like using this one for patients that we might think may have peripheral neuropathy. What we do is I touch a couple different toes at the same time, and I have the patient tell me how many toes are between the 2 toes I'm touching. So I may touch these 2 toes and they would tell me that there's 1 toe between it, or I would touch these 2 and they would tell me that there's no toes between it. Now a positive is if I touched these 2 toes and they said that there was 1 or 2 toes between them, something like that, or maybe they say, I'm only feeling you touch 1 toe. Okay, well that's a positive sign that that nerve isn't healthy or functioning properly. From there we do vibration sense. Again, that's the Pacinian corpuscle there, that's the Pacinian receptor. So we hit the tuning fork and then put it on an area of the body to see if it can pick up the sensation of vibration. Underneath that graphesthesia, that is where we draw the number on the foot or hand to see if they can identify what we drew on them. So that's testing the Ruffini receptor. Now underneath that we have the mechanoreceptors for joint position. Okay, if we have the patient and we tell them, are we lifting your finger up or down, tell me if we're going up or down, and then you do one or the other and they tell you if it's going up or down. So they, a joint position, that feedback in. Obviously balance. Okay, so we're checking the cerebellum, we're checking cranial nerve 8, the vestibular cochlear nerve. Reflexes, okay, that's that motor aspect of the alpha motor neuron. Is that firing down the anterior horn motor neuron and activating the alpha motor neuron, so we're getting the reflex. We do motor testing, so we do a lot of motor testing here. It's one of the things we do most as far as identifying if a muscle's weak, inhibited, not working properly, why it's not working properly, what we need to do to get it working properly. We also do some cognitive tests. So we have patients that have memory issues, traumatic brain injury, stroke, that sort of thing. So we have to do some memory tests. So we do memory test, recall, we do some calculation testing to make sure the left side of the brain's firing properly, have some problem solving. You can even do like identifying a certain tune, that sort of thing, where we're doing kind of the higher levels of brain function. So we have to do all these tests in order to get a good picture on how your brain is functioning, what we need to do to get it right.